a new technology that we've been developing in the Canary Center is a technology that asks the question of how do we find very early telltale signs of cancer in a patient using only their blood. So you can imagine that if cancer cells are growing somewhere in an individual, that what happens is these cancer cells spontaneously die. In some cases are being attacked by the person's own immune system and die. And then in other cases are not dying but still shedding proteins and other biomarkers, as they're called, into their surrounding environment, including the blood. So if we go in and take your blood and there's only a few cancer cells that are shedding things into the blood, a challenge becomes how do you detect very low levels of proteins in your blood that are indicative of cancer. So working with the material science and engineering group at Stanford, in particular Dr. Shan Wang, and our Nanotechnology Center, which I direct here at Stanford, we've been developing a new kind of chip called the Magneto-Nanosensor Sensor. And this Magneto-Nanosensor Sensor is designed to let us find very, very low levels of proteins in your blood, down to the femtomolar level, and maybe soon the attomolar level. This is such a low level of protein that right now if I took your blood and tried to search for proteins at such low levels, no test could identify them. But we now have new technologies based on magneto-nanosensors that are letting us detect these small levels of proteins. They can also let us look for many things in the blood simultaneously, so-called multiplexing, and they can also let us do this in a very high throughput fashion. So we're deploying these chips in some pilot clinical trials now for ovarian cancer early detection, and then hope to also deploy them in prostate cancer early detection towards the latter part of 2011. So we're very excited by this new technology, and it's just one technology of many that are an example of what's possible here at Stanford in the Canary Center.